I was born in Iran. I left Iran with my family when I was 16 years old to pursue higher education. And as we all know, there was a little blip called revolution in 1978-79. And since then we have been in the United States, and I've been in St. Louis for about 25 years. In April of 2006, Mrs. Pujols shared her passion and vision for us to do a dental mission trip to Dominican Republic. And she asked me to put a team together to accomplish that. This is something that I have never done before. It was unique and new to me. The first trip going to Dominican Republic, I had no clue what I was getting involved with. All I knew, just to make sure I have the right group of people together, to have the right supplies and enough supply and equipment that we need down there. I remember it was in January and it was hot. That I do remember. They had no fans in any of these rooms, and I think I said it was hot. It was very hot actually, but it was fun. By the end of the week, we saw over 800 patients. So it was a very good and successful trip. Despite my best efforts, I could not describe the smile on the face of the children, the gratitude their parents express, and the beautiful show of humanity that we all experience as healthcare providers. Pujols Family Foundation has given us that ability for all of us to take a step closer to our own humanity. That's the reason I always go back, because that helps me to be a better human being. Poverty is something nobody can describe unless if the individual has experienced it firsthand or has seen it firsthand. Global poverty that exists and we have experienced and we have seen it in the Dominican Republic is in such that puts our lives in the United States in perspective, and we have to ask ourselves that question: why am I being blessed like that? So as a result, it is my duty as a human being to share that blessing with others. When we are going to treat a child in the Dominican Republic for any dental care, that child is going to receive the same care and compassion and treatment as if that child was here in St. Louis, Missouri. The 10-year-old boy that had a toothache, and we treated that patient and we did few fillings on his adult teeth. What impressed me and what touched me was this patient walked 3-4 miles to get to our place because he has heard about that's where we are, and we were not going to be in his village, so he walked all that way. But he walked with bare feet for him to get to our place, for us to take care of the dental pain that he had. My recommendation to my colleagues is God has given us this skill, and we have to put that skill to use. And I find the Pujols Family Foundation to be a vehicle for me to use the skill that God has given me to the fullest. But this is something that we all can do. It's just a matter of looking inward. With love, we can overcome disease and poverty. And that's what we have been trying to accomplish on every trip to the Dominican Republic.